Hi, everybody. It's Dr. Newman, board-certified plastic surgeon in Westchester, Manhattan, and Long Island. I want to talk a little bit about the common question, or the most common question that I get from patients who are considering breast lift surgery. And that is, well, how long is this result going to last? Well, with breast lift surgery, there's lots of reasons why the breast gets lower. And there's reasons why people come in here asking for breast lifts. Some of it has to do with simply how easily the skin stretches for a particular patient. Some patients come in with lots of stretch marks on their breast. Some patients have no stretch marks on their breast. A lot of it has to do with the patient's natural breast size. The larger the breasts are, the faster gravity is going to work. When I see patients who are very small-breasted, patients who are A cups, and they're 60 or 70 years old, they still have a nice shape. Whereas when I see 25-year-olds who are double D cups, they're frequently very low and very uncomfortable. So breast size or natural breast size seems to really make a difference. When I see patients who are younger, these are patients who are going through times in their lives that are very different than I see when patients are older. When patients are pregnant and their breasts are getting larger, and then they're nursing, and after finishing nursing, their breasts get much smaller again, their skin has stretched out during that process also, and their skin doesn't always snap back to the same point that it did beforehand. Very common for me to hear patients coming in here and talking about how their breasts changed after pregnancy. I've seen some patients whose breast shape improves after pregnancy, but it isn't all that predictable. Some patients' breast shape improves, some patients' breast shape doesn't. Some patients' breasts get larger, some patients' breasts get smaller. But the fact is that when we do breast lift surgery and we're lifting the breast up, and it comes to things that we can possibly do to prolong that result, well, nowadays we have some options. The most important option is that when you do breast surgery, the surgery should not be designed so that the only thing supporting the breast is the skin. When I do breast surgery, a lot of the surgery involves me reshaping the breast on the inside, so the breast itself has the shape and size that we're looking for, and the skin is not really serving as the reason why the breast has the shape that it does. The skin is merely just covering the breast and not really getting pulled by the shape of the breast. When skin gets pulled, skin stretches. If somebody's breast is large, then their breast is going to fall faster. So one of the things that I can do during breast lift surgery is reduce breast size. Now, of course, that's only appropriate for people who feel like their breast is larger to begin with, but in those situations, making the breast smaller definitely helps preserve a breast lift result. But then there become other things that now exist that can also further increase the longevity of a breast lift result. One of those things is what we sometimes call an internal bra or an internal absorbable mesh. This is a mesh that I use during surgery. I use this all the time. This is an advance in breast lift surgery that I'm convinced makes a huge difference. Not in every case. It's more of an issue or more of a benefit, in my opinion, for people who have a large amount of natural breast tissue. But this absorbable mesh lasts about a year. While this mesh is in place, your body will form scar tissue around this and through the holes of this, so that when this disappears, there's a layer of scar tissue on the inside that doesn't stretch as simply as skin stretches. So it helps give the breast a little bit more support. These meshes are made from materials that are similar to the sutures that we use on the inside of the body that are dissolvable or absorbable sutures. It's just simply taking that suture as a thread and weaving it into a cloth. So that's one thing that's a big change over time that we have now that we didn't really have in our toolbox years ago. One of the other things that I do, and I've talked about plus minus breast lifts in the past, but when you reduce the amount of natural tissue that sits over the muscle, there's a little bit less for gravity to work on. Well, frequently I'll do a reduction on somebody, but if the patient doesn't really want to be that small, I'll then put an implant in. That implant then goes in behind the muscle. And with that implant in place, I may take tissue away, give it back with the implant, so the patient's breast size doesn't really change, but the amount of breast that's now sitting over the muscle that's really exposed to gravity, that has changed. So what we typically see with patients whose breasts are large is that they'll have an implant under their muscle, natural breast tissue that sits over the muscle, and because this natural breast tissue is heavy enough, eventually it will pull down with gravity and the skin will stretch, and there becomes this disparity between where the implant is and where the breast tissue is now sitting. By me reducing the amount of breast tissue, but increasing the amount of implant, we preserve the same size for the patient, but the result will last longer because there's a little bit less for gravity to work on. It also helps me preserve the upper pole fullness that everybody wants after they lose that fullness after pregnancy. If you look at the part of the breast that tends to be visible in clothing, it's the upper inner part of the breast that people want to show. And that stays fuller, and I have a little bit more control over how that stays fuller and how long it stays fuller by using an implant under the muscle. So none of these things that I've talked about are things that are appropriate for everybody. Every case is individual, and every case has its specific needs and specific things that can be done and can help. But there's lots of options now that we just didn't have years ago, and these things make a difference. So I hope this helps answer the question about how long breast lifts last and the things that we can do now to kind of affect that and help preserve the longevity and give people a better chance at keeping that result longer.